When a child is unresponsive and not breathing normally, early defibrillation can make a crucial difference. An AED is safe and straightforward, and you can significantly improve chances of survival. Before using an AED, ensure the area is safe for you and the child. Check for responsiveness by gently tapping the child and calling their name. If there's no response, open the airway and check for normal breathing for no more than 10 seconds. If they do not breathe normally, call the emergency services immediately and see if someone can find an AED. Deliver 5 breaths followed by 30 compressions, 1/3 the depth of the chest, at a rate of 100 to 120 compressions per minute, which is about 2 a second. Then continue at a ratio of 30 compressions to 2 breaths until the AED arrives. When the AED arrives, turn it on immediately and follow the voice prompts and visual prompts. Modern AED units provide clear, step-by-step instructions that guide you through the process. You must get the AED on as soon as possible, as the sooner you start, the better the chance of survival. If the child is under 8 years old or weighs less than 25 kilograms, use the child settings on your AED. This reduces the power, but you can still use the same pads. If you're using a different brand and there is no button, use paediatric AED pads if they're available. These are designed to reduce the shock level to a safer level for a child. If paediatric pads are not available or a child setting, use adult pads, but ensure that one pad is on the front of the chest and the other pad is on the back, rather than the standard adult position. For smaller children, place one pad in the center of the child's chest and the other in the center of their back. For larger children, who can fit a standard pad placement, place one pad on the upper right side of their chest and the other under the left side of their rib cage. Once the pads are attached, the AED will analyze the heart rhythm. Ensure no one is touching the child while the AED assesses whether a shock is needed. If the AED advises shock, ensure everyone is clear and press the shock button when prompted. Some AEDs will automatically deliver the shock. After the shock, immediately resume CPR, starting with chest compressions. Follow the AED prompts, which will continue monitoring the heart rhythm and guide you on what to do next. Keep following the AED instructions and do not stop unless the child starts breathing normally, the emergency services take over, or a healthcare professional advises you to stop. Using an AED is safe, simple, and requires no special training. But acting quickly, you can give the child the best chance of survival.